So you guys should have your OB sheet out that says emergency childbirth, okay? These were the complications of pregnancy that I was talking to you guys about. And then these are the complications of delivery that I was talking to you guys about earlier a little bit. We'll see how long this takes to see if we can go over those really quick or not, okay? So the first thing, that's the first step of your guys' OB sheet, is an acronym that we didn't go over in lecture today, but that we're gonna go over right now. So that's PEBBLE, okay? So when we think of PEBBLE, I want you guys to think of, so the first one is paragravida. Does anyone know what para means?
First time ever. How many kids you have?
Okay, so the way I kind of remember it is, what I normally do for you guys is I draw like a P, okay? And then I draw like an upside down G, basically. So the P means how many children do you have, or how many children are you a parent of? That's how I remember it. P is parent, okay? But does this include if there's stepchildren though? No. So we want to know how many they've actually physically delivered themselves, okay? So normally you want to just ask them like, how many children have you actually delivered, okay? Gravida is how many times you've been pregnant, okay? That's why I do the G upside down like a belly. Because that tells you how many times has a patient been pregnant. If the patient says, oh, this is kid number 4, but this is my 6th pregnancy, then we know that those 2 pregnancies, they probably have like either a miscarriage or something happen, because technically the amount of pregnancies versus the amount of kids should equal up, right? Or sometimes you could have one that says, oh, this is my 2nd pregnancy, but this is my 3rd child. Then that would tell you that their 1st pregnancy they had, they had more than one, okay? Does that make sense? So sometimes those numbers can be really confusing, all right? So that's the P. Then you guys have the second P, right, which is your prenatal care. So hopefully the patient gets prenatal care. Remember we talked about before, if they don't have prenatal care, then expect every single complication known to man, okay? That's what your E is, expected complications. So if they've had prenatal care, then you guys will know if there's any expected complications, okay? If they haven't had prenatal care, like I said before, expect every single complication, okay? Then you guys have the first B. If you guys do them out of order when you guys are testing, we're not gonna really mark you down for that as long as you say both, okay? So your guys' says bag of water first. So I'm gonna ask them, has their bag of water broken? If so, then you guys need to ask them, so I do the acronym TACO. Have you guys ever heard of that acronym before? Yeah. So TACO means time. This one's normally appearance. Sometimes people will say, oh, ask the amount. You can do that too. C is the color, and then O is the odor, okay? So you want to know, when did that water break, okay? What did it look like? Did it have a color to it? Did it have a smell to it? Because that's going to tell us whether or not we had meconium staining, okay? If the baby has fetal distress like we talked about before, they're going to have a bowel movement in utero. And then the amniotic fluid a lot of times is going to have like a yellowish, greenish, brownish color to it. Okay, so technically it should just be clear. So if there's any kind of abnormality, then we definitely know that we could have had a meconium staining. Okay, so good for you guys to know. What did I tell you guys in lecture if my baby comes out and the amniotic sac is still in place? What do you do? Yeah, you pinch, twist to break it so that way the baby can come out, okay? Then your guys' second B is to bear down, okay? If they have the urge to bear down, do we let them go to the bathroom? No. No, please don't, okay? So if they have the urge to bear down, then at that time we probably know that they're having that sensation to push, so please don't let them go to the bathroom, okay? Then your paper says L, length and duration of contractions. We talked about that again. Remember when we're talking about how long are the contractions and then how far apart are the contractions, okay? So you want to know that, because remember, if they're 30 seconds to a minute long and they're 2 to 3 minutes apart, birth is probably going to happen there, okay? Unless it's the first baby, like I told you guys before, it's very possible that might not happen, okay? E is gonna be expected due date. So again, if mom's been going to prenatal care, she has an expected due date. If not, we talked about asking about their menstrual cycle, okay? So if you have to ask them their first day of their last menstrual period, then you'll do that, and then we would use the pregnancy wheel to kind of get an estimated delivery date, okay? Then the S is C. We're gonna actually have to visualize. Yes, you guys actually have to look, okay? So let's please be professional about it, and let's please say, you know what, ma'am, I need to go ahead and look to see if I see the baby's head, okay? So let's be professional about it. Let's please not use any other terms for that area except for the proper term, okay? So if you have to tell them, like, look, I have to look at your vagina to check to see if I see the baby's head, then please use that. Don't use any other terms, okay? Then you guys, of course, see the scoring, okay? And then you guys start seeing your actual skill. So the first step, like every other skill, is what? BSI Penman, right? So BSI Penman. Now your guys' always says Don PPEs, and students get so confused on that. They're like, what does that mean? Didn't we already do our PBEs because we did the BSI Penman? Well, when you guys show up on scene, and it's a childbirth, you don't arrive on scene in like a hazmat suit, okay? You arrive on scene with your gloves just like you do every other call. Am I gonna don everything else I need for a childbirth call if I don't know if birth is imminent? Do you need to have everything on? No, okay? So your OB kit, this one doesn't have one, but your OB kit, some of them have you guys ever seen like the lunch lady, like little things? Yeah, the little paper ones or the plastic ones. Yeah, so sometimes your OB kits have those in there, and that's what they tell you to use as a gown. I don't know how much help that's gonna be, but so if I realize birth is imminent, then I'm gonna put on extra PPEs, okay? So that's what it means by don PPE. Okay, so then I'd put on extra stuff, okay, but only if needed, okay. So after you guys don your PPEs, and it tells you guys to ready your OB kit. So when you guys ready your OB kit, my suggestion is that you guys ready your OB kit just the way you're going to use it, okay? So I normally put everything in order the way I'm going to use it. Now you guys can see like our scalpel and stuff like that isn't open yet, okay? So when you guys are practicing, you're just verbalizing, okay? You're verbalizing that you're taking the scalpel and you're using it, okay? We're not opening it and physically using it, okay? Or we wouldn't be able to use these OB mannequins because you guys would constantly be cutting the umbilical cords, okay? So I always set up things how I'm going to use it. So pretty much I've got my pads, okay, I've got my sterile gloves, and when you guys are practicing the sterile glove part, I will use like a regular pair of gloves for you guys and show you guys how to actually use the sterile gloves. The sterile gloves that come in the OB kit are latex, okay? So I don't have you guys open those at all, okay? I will show you guys how to actually use sterile gloves, like with regular gloves. When you guys put them on, so you don't put them on right away, you have to do some cleaning stuff first before you put them on, okay? So I'll show you guys a little bit later how to put those on. Now, it tells you guys to prepare mom for delivery, right? So I gotta prepare mom. How do I prepare mom? What do I have her do? So if we're at her house, right, then I'm going to find a place that would be good for her to be able to lay down on her back, right? I'm going to have, hopefully, if I have extra people there, they're going to help out with like pulling her her legs back whenever we need to, when she's actually like pushing, okay? So if you have like dad there or extra people, use them. Okay, use them to your advantage, okay? So I'm gonna prepare mom for delivery, and I'm gonna explain that procedure to her. It's really good that you guys also explain it to her, because if I don't explain the procedure to mom, what if it's her first baby? She's gonna be scared and nervous, right? So we're gonna prepare her first. So what does that mean I need to do with this? Where do you think I'm gonna put this? Yeah, under her bottom, right? So we need to get a drape and stick it underneath her bottom. Okay, this one's kind of big, so you guys can fold it a little bit smaller. Okay, now these guys have suction on them, so they stick to the thing, so just know that. Thank you. So you're gonna put that drape under mom, and then normally you guys have a couple extra drapes. If it's mom's like second, third baby, she'll probably be like, we're good, just throw one under my bottom, you don't have to cover me up. Okay, so we're gonna put one on this side, and then one on the other side. So we're trying to keep her nice and modest. If you have these ones, these are great to put on top of mom. So the white part here, this absorbs, okay? So which way would I want to put this on mom? So remember, I'm gonna like probably put the baby on top of this originally, right? So I might put it like this so I can put baby up here because that's how it absorbs, right? Okay. If you have extra of these, then put those ones underneath mom's butt because these are amazing. These absorb really well. Okay, all right. But we're gonna use this one just on the tummy for right now, okay? So you guys are gonna drape your mom. Now when you guys are literally practicing with us, we'll kind of pull off like the tummies, and we'll pull this down because if you guys keep practicing through these will like eventually rip, okay? But for time's sake until we get there, that way I can show you guys where you place your hands. We'll just leave it for right now, okay? All right, so I have just got mom on Modest, right? So I'm gonna explain the procedure to mom. What do you think I'm gonna tell her? Ma'am, we're having a baby, okay? So when you're feeling a contraction, I need you to let me know because I'm gonna have you push, okay? So we're gonna try to explain everything about the procedure to mom, okay? So we're gonna be as detailed as we can, like look, whenever you have a contraction, let us know. We're gonna pull your legs back and we're gonna have you push for a good like 10 seconds, okay? So you're gonna walk mom through that, so that way she's a little bit more comfortable, okay? After we explain it, then we're gonna visualize the genitalia. We're gonna look for crowning. Do I have crowning? Yeah, I've got crowning. Oh no, you actually have to deliver. Okay, now yours says to clean. You guys will basically use these guys, these wipes here. I'll open this one. Don't open the actual wipes. Again, just visualize or verbalize it, guys. So we actually have OB wipes that you guys can use in the OB packet. So basically what you guys are going to use for those OB actual towelettes is we're going to do top to bottom, not bottom to top. Okay? So you guys are going to clean one side, throw it away. Clean the other side, throw it away. Clean the center, throw it away. Okay? Now, technically, we call that sterile at that point. Okay? So because I just cleaned her and she's technically sterile, what does it say? I've got to don my sterile gloves. Okay? So with your guys' regular gloves, so technically sterile gloves are folded at the bottom like this. Okay? So when you guys open these up, you have one on either side. You have one on the left and one on the right, okay? So normally you have one on one side and one on the other, and they're folded at the bottom like this. They're folded at the bottom like that for a reason, okay? So I just had gloves that I had on. I gotta take those off, okay? So this is why I tell you guys with OB, I triple glove or double glove. Okay, because I'm going to take that first set off, and I want fresh ones underneath because eventually I'm going to take these sterile gloves off too, right? Okay, remember we talked about trying to put on gloves on sweaty hands, really hard to do, okay? Now, with your sterile gloves, what you want to do is, so my dominant hand, pretty much for me, is my right hand, right? So I'm going to take this one first, okay, my left side, and I'm going to pick it up from the outside, okay? By picking it up from the outside, it stays sterile. I'm going to stick my hand in there, okay, and the job is I'm only touching the outside, okay? And then once I have it on, then we're good. But I might leave it the way it is for right now, because if I touch any part up here, it's no longer sterile, and I have to start all over, okay? So now I'm going to pick up this glove. So remember, you guys would be doing this off to the side, not where I'm doing it, okay? So remember, now I have to pick up the outside of this glove, right? Because if I touch any of this, then that could be a problem, right? Okay? So now I'm going to put this glove on, okay? And now that I have this glove on, if I see I've got little issues, okay, cool. I have sterile, right? We're both sterile. So I could actually now, I can kind of manipulate this a little bit because I'm sterile on sterile. Does that make sense? Okay, and then I can stick my finger in here and I can pull it down. I can stick my finger in this side if I need to, okay? And I can fix it as long as I touch sterile. Does that make sense? So I'm nice and sterile, I'm good to go. Should I be touching things at this point? No, okay? That's where we become non-sterile, okay? Then it tells you, okay, cool, I put sterile gloves on, place gentle pressure on the baby's head to prevent an explosive birth. So this is when I always tell you guys, pretend like it's like you're hiking a football, okay? One hand's gonna go here, one hand on the perineum, okay? Because we wanna prevent that from ripping or tearing really bad, okay? Because that can rip or tear really bad, that would be bad. So mom now has a contraction, so now I'm gonna tell her, okay, when you feel that contraction, I need you to bear down and push as hard as you can, and we're gonna keep our legs back, and I need you to push for a good 10 seconds, okay? So we're just gonna have her, and we're gonna count. 1, 2, okay, keep pushing, 3, 4, okay? All right, then it says that what I just told you guys here, where I'm placing my hands, and what does it tell you to do? It tells you to look for the amniotic sac. If you don't see it, you're good. If you see it, remember, pinch and twist, okay? But as that baby's head's coming out, just make sure that you guys are looking for the amniotic sac, putting pressure on baby's head and on mom's perineum to prevent an explosive birth, okay? So, as baby's head comes out, okay? But let's say if I actually had to pinch the amniotic sac, what do you think you should note of? Note what? The color, yeah, note the taco basically, okay? We already know what time it is that it happened, but notate the color to see if there's a meconium staining, okay? So as the head comes out, what else do you think I need to notate around the baby's neck? Nuchal cord, very good. So as the baby comes out, if I notice I have a nuchal cord, you guys can take 2 fingers, wrap it around there, and try to wrap it around the baby's head. If that does not work, then you're gonna take 2 clamps, you're gonna put it about approximately 3 inches apart. You guys don't need to measure it. Just make sure they're a little apart from each other, and it's the only time you're ever gonna hear somebody say to cut towards yourself. Because if I cut away from myself, where am I cutting? Towards the baby's neck, okay? So you are going to cut towards yourself. If you have a scalpel, towards yourself. If you have regular scissors, turn them so you're cutting towards yourself, okay? But now that I have cut the umbilical cord, what else have I cut? The baby's lifeline, right? The nutrients, the oxygen, all that stuff. So then we need to make it very clear to mom that on this next push, we have to deliver the whole baby, okay? Also, you need to make it very clear to mom if she has a nuchal cord that she needs to stop pushing while we try to reduce it. Because if she continues pushing, what's gonna happen in the nuchal cord? It's gonna get tighter and tighter and tighter, right? Okay, we don't want that to happen, okay? So once we've noticed that we have no nuchal cord and we're good to go, then you remember in the video how the baby kind of rotated itself, okay? So the baby's gonna kind of come out and the baby's gonna kind of rotate himself like this, and you guys will have a partner on the other side that's like pushing the baby out, because this isn't like a regular mannequin that it's gonna come out on its own, okay? So as baby comes out, what are we making sure that we stabilize? Oh yeah, please do, okay? Now, baby at this time may be trying to breathe a little bit, right? So I'm gonna get out my bulb syringe. Has everyone used a bulb syringe before? Yeah? Okay, so in order to use a bulb syringe, I need to actually push down on the bulb syringe in order for it to suction. So I'm gonna suction out the baby's mouth, get all that stuff out, suction the baby's nose. Oh, cool. Thank you. So suction baby's mouth, get it all out. Suction baby's nose, get it all out. Suction the baby other side, get it all out, okay? So remember, you have to squeeze it down, and when you let it go, that's what creates the suction, okay? So suction that baby's nose and mouth. Remember, mouth first, guys, then nose, because remember, they're nose breathers, okay? And then after I suction it, if I need to suction again, can I, once the baby's born? Yeah, you guys can resuction, it's okay. All right, so now baby's whole entire body is gonna start coming out. Oh my gosh, okay? So baby's coming out, all right. So baby's still connected to mom. So we need to keep baby level with mom, okay? Because remember, they're still connected, right? So we've got a nice blood flow and all that stuff. So I don't wanna lift baby up, I wanna keep baby level with mom, okay? So, is this baby gonna be slippery when they come out? Yeah. So this is why I tell you guys that don't fumble your football, okay? No fumbling the football, no dropping the football, okay? You need to hold on tight to that football, okay? So now that baby's out, what should I notate? What should I notate as I warm, dry, and stimulate this baby? Yeah, please notate the time of delivery, because you guys imagine if you guys forgot and mom's like, oh, when was my baby born? Oh, good question, I don't remember. Please make sure you notate time, okay? So we're gonna warm, dry, stimulate, right? after we've warm, dry, stimulated, we need to cut the umbilical cord, right? Okay? Now, your guys' skill sheet tells you 7 inches from the baby and then 3 inches from that. So technically, if you go from the baby, it's 7 and 10. But you guys can say 7 and then 3 inches from the 7, that's fine, okay? So I'm gonna put a clamp here, I'm gonna verbalize, I'm gonna put a clamp at 7 inches, I'm gonna put one at 3 inches from that. I'm gonna wait for that to stop pulsating, okay? Because remember, we talked about if you cut it while it's pulsating, then you're gonna get all that blood splatter in your face, okay? So once it stops pulsating, go ahead and cut it, okay? And then this might be at the point, or maybe before you actually cut this, you might be at that 1 minute AFGAR, right? Okay, so we're gonna pay attention to that. Because during some of that time, we might be at that 1 minute AFGAR and we need to check it, okay? So AFGAR again is appearance, pulse, grimace, activity, and respirations. Very good. Okay, so I'm gonna get that AFGAR score, probably your first one, maybe like a 6, 7, or 8, okay? It's not gonna be a 10, guys, from the get-go, okay? So on your skill sheet, you guys have an actual AFGAR score. Make sure you guys pay attention to that, okay? Because we'll actually give you what your patient is, and you're gonna give us an AFGAR score number, okay? So make sure you guys know that. Make sure you guys study that. Okay, so once I've gotten that AFGAR score, if it's been within that minute, now what I need to do with the baby? Well, I need to make sure to wrap baby up, right? I gotta keep baby warm. Skin to skin would be preferred, only if baby and mom are doing fine now, okay? If baby's not doing too well, then we need to care for baby. If mom's not doing too well, we gotta care for mom, okay? But definitely encourage skin to skin, okay? So normally in your OB kit, you guys will have a blanket. So normally with that blanket, what you guys wanna do is you guys want to secure that baby up nice and good, and then normally you guys will have a beanie that you'll put on baby's head, okay? So that's to prevent my heat loss, okay? And then I'm going to give baby to mom and encourage her to breastfeed. Why would I encourage breastfeeding and skin to skin? What are we doing by encouraging breastfeeding?
The baby knows.
So it does help with contractions for mom, and it helps slow the bleeding down, so that's absolutely correct. That first breast milk that baby gets has lots of antibodies that baby needs, okay? We call it colostrum. And also by mom doing breastfeeding and skin to skin, it also releases what we call oxytocin, which helps with slowing bleeding down, and it helps. Also with them doing skin to skin and breastfeeding, it also helps regulate all the different electrolytes and stuff for baby too, okay? So it actually helps basically create like a baseline for baby and mom, okay? So it really helps them out, okay? So mom's doing skin to skin, she's breastfeeding, so we're encouraging that, okay? Now, if we're at our 5 minute AFGAR score, please do it, okay? If you're not there just yet, you guys can wait for the placenta. Remember I told you guys the umbilical cord will be hanging out, okay? So we're gonna wait for mom to say she has the urge to push again, okay? When she has the urge to push again, then we're gonna be like, okay, probably the delivery of the placenta, or if she tells you, yeah, I'm having twins, then you know it's delivery of probably the placenta and then shortly baby number 2, okay? So mom says she has the urge to push again. We had plenty of time to do our second AFGAR score, because remember I told you anywhere from 10 to 20, even 30 minutes for the placenta. So we had plenty of time to do our 5 minute AFGAR, we're good, okay? So mom says she has the urge to push again, we have her push, and out comes the placenta. Okay, now with the placenta now coming out, I'm gonna check to make sure the placenta is all intact. If I have a chunk missing, then I'm gonna notate that, right? I'm gonna notate that and let the hospital know that. We're gonna place that placenta in the biohazard bag, and we're gonna notate the time of delivery and even possibly the patient's name on the bag. And we're gonna take it with us to the hospital, okay? So that comes with us to the hospital. After we've delivered the placenta, then we're gonna observe for bleeding, okay? You guys are gonna take a pad, and you're gonna place the pad here, and you're gonna have mom basically close her legs, okay? You're gonna have mom close her legs, and then You guys don't need to put multiple, just one's fine. But you guys need to pay attention to these, because if mom goes through one of these and soaks it, then we're gonna put a second one over the first one, okay? If she soaks through both of those, take the second one off, put the third one. If she has gone through 5 or more of these, then she's hemorrhaging, okay? So for something we do to help prevent the hemorrhaging from happening is in the lower part of the abdomen here, you guys are going to find, it almost feels like a grapefruit shape, and it's the uterus. So what you're gonna do is you're gonna massage the fundus. That's what your skill sheet says. It says massage the fundus, okay? And we're not talking like massaging it like, it's almost like kneading bread, okay? So if you've ever kneaded bread before, that's what it's like. It's not like a kitten that just kind of tiptoes on you. You gotta put some pressure behind it, because we're trying to create the contractions to slow the bleeding down, okay? And then of course, if my mom's starting to have some significant bleeding, then we're gonna start doing shock treatment, right? So we're gonna make sure that we give mom a blanket. We may have to give her oxygen too, okay? And then once we're done and we're transporting, we're gonna continue to transport mom and baby to the hospital, okay? And our job is to continue to monitor them all the way there. Questions?
Are you reassessing vitals 5 or 15 minutes?
So as long as mom is doing well, I would say initially go 5. As long as mom is doing well, then you can do every 15. But initially get a baseline vitals, check them a little bit later. If things look well, then you could probably do them every 15. If mom starts not doing well, starts becoming more lethargic, her level of consciousness is kind of in and out, then I would do more frequent vital signs, because it probably means she's probably hemorrhaging at some point.
And the baby as well?
Yeah, so with neonates in general, you guys are just gonna pretty much monitor their SpO2 and their heart rate, okay? Trying to get a blood pressure on a neonate, you guys on the ambulance don't even have cuffs that small. So you guys won't be able to get a blood pressure, but pulse ox is super important, and so is heart rate, okay? And then of course looking at the skin color of the baby, right? So if the skin color doesn't look well, then you guys know definitely something's wrong, okay? They're not perfusing well. So again, your first step, like before, BSI Pinman. Then it says assess neonate immediately after birth and identify need for resuscitation. So if we have a decreased respiratory rate or poor oxygenation, there's gonna be different steps that we're gonna follow, okay? It says I also need to look at a decreased heart rate between 160, okay? So I'm looking at, and then we're talking at the apical site. So the apical site is actually on the heart, okay? So you guys are actually going to check, it's pretty much like the base of the heart, where you guys are basically gonna listen, okay? And then if you notice that that is low, then you're gonna have to look for that need for possible resuscitation, okay? If the baby is breathing or crying, warm and maintaining body temperature, it says position the airway, clear secretions if needed, and give infant to mom. So if baby's doing great, we're gonna give baby to mom, okay? If baby's not, we're gonna start identifying things of bradycardia, hypoxia for that kiddo. So you guys have a list. You're gonna identify apnea, respiratory distress, hypoxia, heat loss, need for stimulation, and need for suction, okay? Okay, I've got more of a decreased respiratory rate. We've got poor oxygen signs. My skin signs aren't looking good. So this is when we're gonna start with oxygen, okay? If your baby's breathing okay, but may need a little help, then you can just do blow-by to start with. If your baby looks like they need more help, then you're gonna get that BVM, okay? You're gonna put that BVM on oxygen, and you're gonna give them the adequate ventilations, okay? Then it tells you heart rate is 60 to 100. Then I'm gonna actually do ventilations with that BVM 40 to 60 times per minute, okay? Originally you could do it on room air, but please make sure you get it on O2 soon, because that's gonna help the baby, okay? And I know it tells you to warm, dry, stimulate the infant, but before you guys start ventilating the patient, you should have done that already, okay? Warm, dry, stimulate's like step 1, okay? Then it says if no change in heart rate after 90 seconds, make sure you get them on 100% oxygen. Now, just like we talked about in class, if the heart rate drops, and you've done all that so far, my heart rate drops below 60, Now I need to actually do compression and ventilations, okay? So remember your guys' compression and ventilation ratio is 3 to 1, and you guys are gonna provide 100% oxygen. Now hopefully already, because it says be mindful to clamp the cord first before starting compressions. Hopefully you've already cut and clamped the cord at that point, okay? And then it says request ALS response if needed, emotional support to mom and family. Again, just talk to mom, let her know what's going on. Hey, baby's not breathing as well as we want them to, and let them know what you're doing, okay? And then it says continue to reassess infant en route, okay? So constantly monitor for changes as well, okay? Questions?
I was going to ask what happens if you do compressions while the umbilical cord's still attached.
So the problem is, because remember, can you do compressions right here very well? No, right? Do you have the support that you need, really?
Oh, I see.
Right?
Okay.
So remember, if baby's attached, right, and I don't cut and clamp the cord, and I start, baby's still attached, and I try to move baby over here, the cord's only so long, guys, okay? Right, remember we talked about not pulling on the umbilical cord because it could cause the rupture of placenta, and the placenta can rip off the uterine wall, and then mom could start hemorrhaging, right, okay? So we want to clamp and cut that cord, get baby detached, right? And then start working on baby. So you guys can warm, dry, stimulate originally if you need to, but as soon as you start noticing that baby's not responding very well, clamp and cut that cord, get that baby so you can actually work on the baby more, okay? So even if that means you got to do a little bit more rigorous kind of warm, dry, stimulating off to the side because you have an area to lay the baby down, then do so. Okay, but remember, we're going to start with oxygen first because all of our pediatrics rely more on the respiratory side of things than the actual cardiac side of things originally. Okay, so only when you've tried all that stuff and all else fails, then you're going to compressions if that heart rate drops below 60. Because remember, a neonate should have a heart rate, what, 160, 180? Should be up there, pretty high.
If you get return of ROSC, are you breathing for that baby every second?
So if you get return of ROSC for the baby, like you mean you get a pulse back, but not respiratory back?
Well, return of spontaneous circulation.
So you get a pulse back, but you get respirations back?
Yes.
You get respirations back too? If you get respirations back and a pulse back on a baby, then you might just do blow by oxygen.
Okay.
Yeah, you might just keep them on 100% O2. If you get pulses back and you don't get respirations back, then you're going to ventilate for the baby, but then we're going to go back to the rescue breathing, which we would breathe for them 1 every 2 seconds, right? Because infants technically 1 every 2 to 3. Mm-hmm. So we're going to do 1 every 2 because it's a neonate. So we're going to breathe a little faster for them.
Is it possible for the mom to ever pass out during childbirth?
Yes, so actually if you have a mom that's under like, maybe she's intoxicated or heavy on drugs, as mom's pushing, so you can actually have a situation where like the head's out and mom just goes unresponsive on you. Okay, so of course, then hopefully you have extra hands so someone can attend to mom. But remember how in the video that the baby like pretty much did all of it on its own, right? So as you guys saw that once that head kind of started coming out, then baby started rotating and doing everything on their own, okay? So that baby, you'll just assist the baby kind of the best that you can on the rest of the way out, okay? If mom is in the middle of delivery, like eventually baby's gonna go through that birth canal. If for some reason all of a sudden the delivery stops because there's complications for that, then at that point it would be like a code 3 transport to the hospital. But yeah, there are instances where mom is pretty intoxicated or is on heavy duty like drugs that technically aren't prescribed, where they can basically go unresponsive, and then you're just then assisting the baby.
What if like on the scene, it's like you and your partner, just you and your partner, the mom and then the dad, but he like passes out?
It's possible.
What do you do there? Like you just ignore it and like continue with the delivery, or?
No, so pretty much at that point, right, you would call for a second unit because you need extra hands, right? So you're gonna call for a second unit, someone's gonna attend to dad, right? Or the other person's gonna have to attend to mom. Okay, so you're gonna have to split up at that point, and you're just gonna have to make it work, right? So you're just gonna request for extra resources. So most of the time when like we get a 911 call, normally it's an ALS unit where you have the paramedic and you have the EMT and then the fire shows up too. So normally you have extra hands, but let's say that you guys are, you get like flagged down or something, right? You're on a transfer, somebody flags you down on the side of the road. They're like, oh my, like so-and-so's delivering in the back of the car, right? And you guys go over there to help. My suggestion from the get-go is to request for additional resource from the get-go, okay? So, because eventually you're probably gonna need, possibly, maybe not, but you're gonna have to transport that kid eventually. So get an additional unit there so you have the extra hands. So that way if something like that does happen, dad passes out, you have that extra unit already on the way. Guys, I'm gonna tell you now, the neonate resuscitation, because it's such a short skill sheet, you guys don't feel like you need to practice it and you're like, oh, I got it. There's a lot of information on there, okay? That is the most failed skill, is neonate resuscitation. Now, if you guys look at the OB skill, you guys see all that verbiage. If you guys say and do at the same time, you'll be fine, okay? It's just kind of a thought process. Okay, the next step is this, the next step is this, the next step is this. So when you guys are practicing, someone needs to be doing why the person doing should be saying. Your partner should have the skill sheet, so if you miss a spot, then they can tell you it, okay? Or initially you can have your skill sheet off to the side and you can read it, okay? Be a side pin man, but make sure you're doing the steps as you're saying it out loud, because guess what? You memorize it better that way. Okay, especially for this skill, because it's just common sense, okay? Baby's been delivered, okay, time of birth, right? So some of that stuff is just like, oh, well, yeah, of course, I'd want to know that, right? Okay, of course, like after I do my AFGAR score, I got to cut and clamp the cord, right? So a lot of this stuff is just like, oh, okay, that makes sense. That's the next step anyway, okay? So if you guys read initially today and do at the same time, then you guys will be good, okay? That's how I'd recommend to practice.